Let's talk here about another class of tools that intermediaries can use to influence care use and costs. This will be a set of tools to directly control or manage utilization. Mainly, we're thinking here about intermediaries setting the terms governing coverage. Intermediaries normally agree that they'll cover or contribute to the cost of healthcare, but require that patients meet certain conditions for that to happen. They can vary those conditions with requirements about how enrollees use care. There are a variety of ways that this can happen. Here are a couple key examples. The first one we'll call a gatekeeper requirement. This refers to a requirement that patients must select or be assigned to a particular primary care physician and then have to see that physician as their first point of contact for any medical issues if the plan is going to cover. Before they go see a specialist, for example, or get testing, they need to see and get a referral from the primary care doctor. The idea is that this could be good for quality if a primary care doctor can do a good job coordinating care and managing complex situations, and it might reduce costs by, say, cutting down on excess use of specialists or tests if they're not really needed. On the other hand, it imposes a restriction on patients, and critics might worry about limiting too much. And before you get too worried about emergency situations here, plans using this almost always incorporate exceptions for emergencies and related situations. The other example we'll call out here is utilization review. Utilization review is a general term that refers to plan efforts to monitor the utilization of patients and try to be involved a bit in guiding decisions about care use. It's often said to come in three main types. One is pre-authorization or prior review. This is a requirement that, for certain services, the plan approve of use before the service is delivered if the plan is going to cover it. For example, a physician may refer a patient for some service like an MRI, but if this is covered by a prior review requirement, the patient or the physician maybe will have to get approval from the plan in advance, or else the plan will not cover the test. The plan can then look at the circumstances and weigh in about whether they think the test is needed or not, and they can turn it down if they think not. Or they might do other things like maybe require the patient to try some less expensive therapy first before they go for the more expensive one. In this case, if the patient went ahead and got it anyway, the patient would be on their own for the costs. A plan could target pre-approval requirements at services where they're worried about overuse of expensive but low-value things, for example. A second version of utilization review is concurrent review, where you see plans monitoring care as it's being given and attempting to influence care. For example, sometimes when a patient's in the hospital, there may be some sense in advance of how long the patient is expected to stay, and then the plan might keep tabs on how long the patient's been in. If the stay starts to stretch beyond what the plan thinks the normal length of stay should be, then they may try to influence the care, maybe getting in contact with the physicians or providers to try and influence subsequent choices, or state some guidance about the circumstances under which they'll cover for continued care. And then the third area is retrospective review, which can happen after the care is completed. Plans might decide to take a look at care that was delivered and may review that for appropriateness. Gatekeepers and utilization review can be interesting and effective. They give plans the ability to influence care. Some people argue they have pluses, maybe helping improve quality and cut down on the use of unnecessary or low-value services. But they can also be controversial, of course. For example, because they involve a health insurer trying to manage healthcare delivery, and patients and providers often want to control that entirely themselves. There are other things that can happen in the space of plans trying to influence care as well. They might, for example, monitor providers by collecting data on their use of certain services or their quality scores or other things, and then provide feedback to the providers that might influence the utilization of care. Working with patients, they might send reminders and other information to patients to try to influence their utilization. This space overall has quite a few different things going on in it that you can look out for, and hopefully covering a few here will get you started.